Hello and welcome to our webinar on documentation of chiropractic services. My name is Jennifer Boniface and I am one of the nurse analysts with the Provider Outreach and Education team. Today's webinar will focus on Medicare's documentation requirements for chiropractic care. And I just see someone just put in about access to the slide deck. It is under that live events. If you click that link that we put in there for live events, you can download the presentation. So I do have some housekeeping items to go over with you before we start the webinar. You can find the link to the encore presentation of this webinar on our website's training center page at www.wpsgha.com, and it will be accessible for the next 60 to 90 days. Additionally, the recording will be uploaded to our YouTube channel under the Encore Presentations playlist, and both should be available within the next 15 business days. If you have any questions, please put those questions into the chat. We will answer questions as time permits. And should we be unable to answer a question during the webinar, we will create a follow-up document and send it to all attendees afterward. And I did incorporate many of the pre-submitted questions into this presentation. We really want your feedback. It helps us develop education on topics that may be of interest to you. So consider taking our survey to let CMS know what you did like and what topics you'd like to learn more about. Mary Sue will place a link to the survey into the chat. There will also be an opportunity at the end to take the survey. Additionally, you can provide feedback by completing the survey while viewing the encore presentation. To access that survey, just click on the circle with the eye in the upper right corner of the video. And a link to the survey can also be found in the description of the video. On this slide, we have our disclaimer. Medicare rules change often, so please make sure you're looking at official CMS communications for the most up-to-date rules and regulations, and these do take precedence over anything presented today. And as a reminder, CMS prohibits recording of this presentation for profit-making purposes. This presentation is being recorded by us and will be posted on the Training Center page of our website under Encore Presentations, as well as on our YouTube channel under the playlist Encore Presentations. This slide contains the CPT copyright notice, and this is a requirement to be provided to you since we have CPT codes within the presentation. Please review this information at your convenience. On this slide, you will see there are several acronyms used during this presentation. Many of them you might already know, but if you find an acronym we discussed today that you're not familiar with, please refer back to this slide for guidance. So let's get started. Accurate and comprehensive documentation is an essential component of chiropractic care, especially when billing for services and submitting claims to Medicare. Proper documentation helps ensure compliance with Medicare regulations, reducing the risk of claim denials. It also allows you to clearly demonstrate the medical necessity of services provided. And ultimately, thorough and complete documentation supports accurate submission or accurate claim submission, helping to ensure appropriate reimbursement. Our objective for today is to provide an overview of the documentation required for delivering and billing chiropractic services. We will cover an overview of chiropractic care, coverage criteria, documentation requirements, and helpful tips to support proper documentation of chiropractic services. So let's start with a brief overview of what chiropractic care is. The National Center for Complementary and Integrative Health defines chiropractic care as a licensed healthcare profession that emphasizes the body's ability to heal itself. Chiropractic services are primarily focused around diagnosing and treating conditions related to the nervous and musculoskeletal systems, with a particular emphasis on the spine. Chiropractors use hands-on spinal manipulation and various manual techniques to alleviate musculoskeletal pain, such as back pain, neck pain, joint pain, sports injuries, and headaches, among others. Although treatment is typically provided by a chiropractor, chiropractic care often involves a multidisciplinary approach, where chiropractors may work alongside other healthcare professionals to create a comprehensive treatment plan, particularly in more complex cases. Chiropractic services often include a variety of therapeutic approaches such as spinal manipulation, also known as chiropractic adjustment, and this is where chiropractors use controlled force to adjust the spine and other joints, helping to reduce pain and improve function. Spinal manipulation is often considered the primary treatment in chiropractic care, though it can be highly individualized. Not all patients may receive spinal manipulation as the first or only treatment, as it depends on their specific condition or needs. The next is physical therapy techniques. Chiropractors may incorporate exercises, stretches, or other physical therapy treatments to improve mobility and reduce pain. The third approach is soft tissue therapy. This includes treatments such as massage and myofascial release, which helps alleviate muscle tension and improve flexibility. Next is lifestyle and posture advice. Chiropractors also provide guidance on posture, ergonomics, and lifestyle changes that can help prevent further injury or discomfort. Lastly is nutritional counseling. Chiropractors may also provide advice on diet and supplements to support overall musculoskeletal health. Medicare Part B covers chiropractic care, but it's important to understand that this coverage is very specific. It only includes manual manipulation of the spine performed by a licensed chiropractor, and only when it's medically necessary to treat or correct a condition called vertebral subluxation. This means the treatment is specifically focused on correcting the misalignment rather than for routine maintenance or wellness. A subluxation refers to a condition where the spinal joints are not moving as they should, even though the joint surfaces are still in contact. This can affect spinal alignment, movement, and overall physiological function of the spine. Manual manipulation refers to hands-on treatment of the spine. Chiropractors may use handheld manual devices to assist with this manipulation, where the force is applied is still manually controlled. However, Medicare does not allow separate payment for the device or its use. Chiropractic services that are not covered by Medicare include, but are not limited to, laboratory tests, x-rays, office visits including history and physical, physiotherapy, traction, supplies, injections, drugs, diagnostic studies including electrocardiogram, orthopedic devices, and nutritional supplements and counseling. Medicare also excludes coverage for chiropractic adjustments to extraspinal regions, which involve areas such as the head, extremities, rib cage, and abdomen, and that's billed under CPT code 98943. Additionally, Medicare does not cover other diagnostic or therapeutic services ordered or performed by a chiropractor, including ordering, administering, or interpreting x-rays, providing massage therapy, performing diagnostic tests, or delivering acupuncture, except in cases where acupuncture is specifically used to treat chronic lower back pain. After the Medicare Part B deductible is met, the beneficiary is responsible for 20% of the Medicare approved amount for the covered chiropractic services. In order for Medicare to cover chiropractic treatment, the following conditions must be met. The patient must present with a significant neuromuscular skeletal condition that requires treatment. The manipulative services must have a direct therapeutic relationship to the patient's condition. There must be a reasonable expectation that the manipulative services will result in recovery or functional improvement, and the patient must have a subluxation of the spine confirmed by X-ray or physical exam. There are two categories of subluxation. I apologize on that. There are two categories of subluxation under Medicare, acute and chronic. Acute subluxation typically results from a recent injury. Treatment is focused on achieving significant improvement or preventing further deterioration. This is classified as active or corrective care and is eligible for Medicare coverage. Chronic subluxation refers to long-term or recurrent displacement of the vertebra. Although full recovery may not be expected, Medicare may cover continued treatment if there's a measurable functional improvement. This may still qualify as active treatment, but only if ongoing progress or benefit can be demonstrated. Once a patient's condition becomes stable and no further improvement is expected, the care is classified as maintenance therapy. Maintenance therapy includes treatment designed to prevent disease, promote health, enhance quality of life, or maintain function and prevent deterioration in chronic conditions where no significant functional improvement is anticipated. Medicare does not cover maintenance therapy. Before we move on, I'd like to address a pre-submitted question we received about supportive chiropractic care, specifically whether Medicare covers it. Supportive care refers to long-term, regularly scheduled visits intended to help maintain function over time. However, Medicare does not cover maintenance therapy, which is defined as ongoing care when no further objective improvement is expected. If chiropractic treatment is considered supportive or maintenance rather than corrective, it is generally not eligible for coverage. Documentation needed to support chiropractic services include the patient's name and date of birth, date of service, medical need, initial evaluation, treatment plan, number of regions manipulated, method of manipulation, provider's dated signature with credentials listed, other documentation supporting medical necessity, including abbreviation logs, acronym definitions, and signature logs or attestation statements, and advance beneficiary notice of non-coverage if given. So now let's take a closer look at documentation requirements for chiropractic services. We'll first begin with the medical need. Documentation of subluxation can be demonstrated by X-ray or physical exam. While an X-ray is not mandatory to demonstrate subluxation, it may be used at the chiropractor's discretion. A CT scan, MRI, or both showing the level of spinal subluxation is also acceptable. In order to be considered timely, the X-ray must be taken no more than 12 months prior to or within 3 months after the start of chiropractic treatment. In cases of chronic subluxation, such as scoliosis, Medicare may accept older X-rays as valid if the patient's medical history indicates the condition has persisted for more than 12 months and it is reasonable to conclude that the condition is permanent. A previous CT scan or MRI showing subluxation of the spine is also acceptable. Documentation should include a review of the X-ray, MRI, or CT scan and should clearly indicate the level of subluxation. Medical need can also be demonstrated through physical exam using PART. The P stands for pain or tenderness. Pain or tenderness should be evaluated based on factors such as location, quality, and intensity. This assessment can be performed using one or more of the following techniques: observation, palpation, percussion, or use of a pain scale such as on a 1 to 10 scale or through a pain questionnaire. Be sure to include specific details when documenting the topic of pain or tenderness. The A stands for asymmetry or misalignment. Asymmetry or misalignment can be assessed through observation, static palpation of the vertebral segments for misalignment, or diagnostic imaging. Make sure to document the specific sectional or segmental level of asymmetry or misalignment and how this was determined. The R stands for range of motion abnormality. Range of motion abnormality refers to changes in active, passive, or accessory joint movements that lead to either increased or decreased mobility at a specific segment or site or section of the spine. This can be assessed through observation, motion palpation, stress diagnostic imaging, range of motion tests, or other measurements. Ensure that documentation includes any changes in active, passive, or accessory joint movement that affects sectional or segmental mobility. The T stands for tissue tone changes or abnormalities in tissue tone, texture, and temperature, affecting the characteristics of contiguous or associated soft tissues, including skin, fascia, muscle, and ligament. This can be assessed using techniques such as observation, palpation, instrumentation, or tests for tissue length or strength. The Medicare Benefit Policy Manual, Chapter 15, Section 240.1.2 specifies to demonstrate subluxation through physical exam, two of the four criteria under physical examination must be met, with one being either asymmetry, misalignment, or range of motion abnormality. Next, let's move on to the initial evaluation. This evaluation requires several key elements to be documented in the patient's record. The first component is patient history. The history should include the date of initial treatment, chief complaint outlining the symptoms that led the patient to seek care, relevant family history, and past medical history, including general health, previous illnesses, injuries, hospitalizations, medications, and surgical history. The second element is description of present illness. This section should provide a detailed account of the current condition, including mechanism of trauma, quality and character of symptoms or problem, onset, duration, intensity, frequency, location, and radiation of symptoms, aggravating or relieving factors, previous interventions, treatments, medications, and secondary complaints, and symptoms that prompt the patient to seek treatment, along with clear documentation showing how these symptoms correspond to the level of subluxation identified by the chiropractor. And please note, simply stating that there's pain on the claim is not enough. The provider must specify the exact location of the pain and indicate whether the identified vertebra is capable of causing pain in that area. The third element is the physical examination. The physical exam should use the PART system to evaluate the musculoskeletal and nervous systems. And finally, the last element of documentation is treatment provided on the day of visit, if applicable. Documentation should include the specific areas and levels of the spine manipulated. The chiropractor can document the degree of subluxation by either listing the exact vertebrae, for example, C5, C6, etc., or specifying the area of subluxation if it involves only certain bones, for example, the occipital atlantal, lumbosacral, or sacroiliac. The chiropractor must specify the precise level of subluxation or the exact bones involved within the medical record to support a claim for spinal manipulation. On the claim, the precise level of subluxation should be listed as the primary diagnosis, and the neuromusculoskeletal condition requiring treatment should be listed as a secondary diagnosis. When applicable, any justification for prolonged or extended course of treatment must be consistent with the reported diagnoses and well documented in the medical record. Additionally, the provider should consider any contraindications to treatment, particularly related to dynamic thrust. Chiropractic treatment often involves dynamic thrust, a therapeutic force applied by the chiropractor when manipulating a specific anatomical area. There are two types of contraindications to dynamic thrust, relative and absolute. Relative contraindications suggest an increased risk of injury, but do not completely rule out treatment. The potential risk must be discussed with the patient and documented in their record. Examples of conditions with relative contraindications to dynamic thrust include articular hypermobility or uncertain joint stability, severe demineralization of bone, benign bone tumors of the spine, bleeding disorders or anticoagulant therapy, and radiculopathy with worsening neurological signs. Absolute contraindications mean dynamic thrust is completely contraindicated near the site of the identified subluxation and the intended area for manipulation. Examples of conditions with absolute contraindications to dynamic thrust include acute arthropathies with inflammation, lentiginous laxity, and anatomical subluxation or dislocation, including acute rheumatoid arthritis and ankylosing spondylitis. Also included is acute fractures, dislocations or healed fractures, and dislocations with signs of instability, an unstable os auditorium, malignancies involving vertebral column, infection of bones or joints in the vertebral column, signs and symptoms of myelopathy or caudal equina syndrome, for cervical spinal manipulations, vertebropatellar insufficiency syndrome, and significant major artery aneurysm at the proposed site of manipulation. The patient record should also include a detailed treatment plan. The treatment plan should clearly indicate several key components. First is duration and frequency of visits. The documentation of treatment should specify both the frequency and duration of treatment, as well as the medical necessity of the chosen frequency and duration. Using terms such as PRN or return as needed alone do not satisfy the requirements of a complete treatment plan. Supporting documentation must be provided to justify the need for extended treatment. Additionally, the treatment should lead to an improvement or prevent further deterioration of the subluxation within a reasonable and generally expected time frame. Next is specific treatment goals. These goals should be specific and achievable so they can help guide the treatment process. Objective measures are also needed to evaluate treatment effectiveness. These help ensure the progress can be tracked and adjustments made if necessary. And finally, include details on the recommended level of care appropriate for the patient's condition and progress. All subsequent visits should be documented in the patient record. Documentation for each subsequent visit should include history, including review of chief complaint, any changes since the previous visit, and review of symptoms if applicable. Physical examination using PART, including examination of the spinal area relative to the diagnosis, assessment of any changes in the patient's condition since the last visit, and evaluation of effectiveness of treatment, and finally, any treatment given the day of the visit, including specific areas and levels of the spine that were manipulated. Now that we've covered documentation required during chiropractic visits, let's focus our attention on claims documentation. Claims for chiropractic services should include the date of the initiation of the course of treatment, symptoms, condition, secondary diagnosis codes, subluxations, primary diagnosis codes, date of service, place of service, and procedure code. If these items are not reported, your claim may be denied or delayed. Diagnosis codes for chiropractic services are typically grouped into 4 categories. Group 1 codes are primary ICD-10 codes and are the only codes that establish medical necessity. These must identify the specific level of subluxation, usually using ICD codes from the M99.0X series. Groups 2 and 3 and 4 include secondary ICD-10 codes that support the patient's presenting symptoms or condition. These groups are also help determine the expected duration of treatment. Group 2 codes are diagnoses that generally require short-term treatment. Group 3 codes are diagnoses that generally require moderate-term treatment. And Group 4 codes are diagnoses that may require long-term treatment. So before we move on, I want to address another pre-submitted question we received. The question asks, can we get an idea of what Medicare considers short, moderate, and long-term treatments in terms of the number of visits? For example, ICD-10 code M47.812 is considered short-term treatment. Is that 2 to 4 visits long or closer to 6 to 8? Medicare does not publish fixed visit range categories. For example, short equals 2 to 4 visits, moderate equals 6 to 8, long equals 10 or more for each ICD-10 code. These categories are not based on rigid thresholds, but rather on the condition's severity, anticipated recovery course, and clinical judgment. The groups are intended to assist in determining what constitutes reasonable and necessary care. However, exceeding typical visit ranges requires strong documentation of medical necessity. If you review local coverage article LCA A56273, Billing and Coding Chiropractic Services, you'll find ICD-10 codes grouped into short, moderate, and long-term duration treatment categories, which can help guide expectations for episode length. A list of this billing and coding article was placed into the chat, and it can also be found on the resources slide at the end of the presentation. Under Medicare, chiropractors are limited to billing 3 specific CPT codes for spinal manipulation: 98940, which is chiropractic manipulative treatment of 1 to 2 spinal regions; 98941, chiropractic manipulative treatment of 3 to 4 spinal regions; and 98942, chiropractic manipulative treatment of 5 spinal regions. When billing for manipulative services, chiropractors must use the AT modifier. This modifier indicates that the service is active or corrective treatment for acute or chronic subluxation. Proper use of the AT modifier demonstrates the expectation of functional improvement, even in cases of chronic or recurring conditions. Now let's view the AT modifier in more detail. Medicare only covers treatment involving manual manipulation of the spine to correct a subluxation. This treatment must be classified as either active, to be eligible for coverage. The AT modifier was introduced to distinguish active treatment from maintenance therapy. Medicare provides coverage and payment only for active or corrective treatment designed to address acute or chronic subluxation. Maintenance therapy is not covered. When billing for active or corrective treatment of subluxation, it is essential to include the AT modifier on the claim. Again, the AT modifier should only be used when chiropractic manipulation is considered reasonable and necessary according to Medicare guidelines. Its presence on the claim indicates the billed service is for active or corrective treatment. However, documentation must clearly support this and meet Medicare's medical necessity and coverage requirements. Please keep in mind that the AT modifier itself does not guarantee the reasonableness or necessity of the service. Contractors may still deny the claim after medical review if the service does not meet the criteria for being reasonable and necessary. For this reason, it's important to regularly review updates to local and national coverage policies regarding coverage criteria, as policies can change over time. Always ensure that the documentation supports the use of the AT modifier, reflects active or corrective treatment, and demonstrates medical necessity. The correct use of the AT modifier indicates active or corrective treatment for acute or chronic subluxation through manual manipulation of the spine, performed either by hand or the handheld device, with the expectation of improving the patient's condition or preventing further progression. As a reminder, the procedure codes that should be used are 98940, chiropractic manipulative treatment of 1 to 2 spinal regions; 98941, chiropractic manipulative treatment of 3 to 4 spinal regions; and 98942, chiropractic manipulative treatment of 5 spinal regions. It's important to remember that the chiropractor must clearly identify the exact level of subluxation or specific spinal segments involved to support a claim for spinal manipulation. On the claim, the precise level of subluxation should be listed as the primary diagnosis, and the neuromusculoskeletal condition requiring treatment should be listed as the secondary diagnosis. The AT modifier should not be used for chiropractic services that are considered maintenance therapy. And again, as a reminder, maintenance therapy refers to a situation where the patient's condition has stabilized and additional treatment is unlikely to result in further improvement. Finally, let's wrap up by reviewing a few helpful tips for ensuring proper documentation of chiropractic services. Always include the patient's name and date of service on all documentation. Make sure to include records for all dates of service on the claim. Ensure all documentation is clear, concise, and legible. All entries must be authenticated. Entries should be signed and dated in a timely manner. Ensure signatures are legible and include the credentials of professionals providing services. If the signature is illegible, provide a signature log or an attestation statement to confirm the signature. Both handwritten and electronic signatures are acceptable. For electronic records, include the electronic signature policy and procedures that outline the process for signing and dating notes and orders. Stamp signatures are generally not permitted except in special circumstances. Per the Medicare Program Integrity Manual, Chapter 3, Section 3.3.2.3a, CMS allows stamped signatures if the provider has a physical disability that prevents them from signing, provided they can demonstrate this disability to a CMS contractor. Next, avoid using non-standard abbreviations. If abbreviations are used, make sure to include a abbreviation key in the patient record. Include all additional documentation to support medical necessity of the billed services, along with a copy of the Advanced Beneficiary Notice of Non-Coverage and any related supporting documentation if applicable. For more information about signature requirements, please refer to CMS's Fast Fact Sheet, MLN 905364, Complying with Medicare Signature Requirements. For additional information regarding documentation for Medicare, please refer to the WPS article, Complete and Timely Documentation of Medicare Services. Links to both of these have been placed on the resources slide at the end of the presentation. Complete and accurate documentation of chiropractic care is crucial not only for delivering high-quality care to the patient, but for also supporting proper billing and ensuring appropriate reimbursement for services rendered. During today's webinar, we provide a brief overview of chiropractic care, explored coverage criteria, discussed documentation requirements, and provided helpful tips to support documentation of chiropractic services. The next 3 slides contain resources with links to key information covered in today's presentation. The first slide includes materials from the CMS website, such as the local coverage article A56273 on billing and coding for chiropractic services, the Medicare Benefit Policy Manual, Chapter 15, Sections 30.5 and 240, the Medicare Claims Processing Manual, Chapter 12, Section 220, and the MLN Matters article SE 1601 on documentation requirements for initial and subsequent visits. The second slide offers additional resources from the CMS website, including the MLN Matters articles SE 1602 on the use of the AT modifier for chiropractic billing and SE 1603 on educational resources for chiropractors. It also features MLN 1232664 Medicare Documentation Checklist for Chiropractic Doctors, MLN 4824456 Medicare Provider Compliance Tips, and MLN 905364 Complying with Medicare Signature Requirements. The final resources slide lists resources from the WPS website covering topics such as chiropractic claims, documentation, the AT modifier, treatment plans for chiropractic manipulation services, and the importance of complete and timely documentation of Medicare services. These slides can serve as a helpful reference as you review the information presented today. We are now at the end of the formal presentation. Please remember, if you have any questions, please put those questions into the chat. To start, I'd like to go over a few questions that were submitted ahead of time. If you don't get your questions today during the presentation, we will send out a document to all participants with the answers following this webinar. So the first question asked, are Medicare patients limited on visits yearly? Medicare Part B covers chiropractic care only for spinal manipulation aimed at correcting a vertebral subluxation. Coverage continues as long as the treatment is medically necessary and directed toward active subluxation with proper documentation to support it. Claims must include the appropriate CPT codes 98940 through 98942 with the AT modifier and be backed by exam findings such as part criteria, precise diagnosis, and a clear treatment plan. Once care shifts to maintenance or wellness, Medicare will no longer cover it. Question 2 asks, can an FQHC bill for chiropractic services? According to the Medicare Benefit Policy Manual, Chapter 13, Section 110.1, FQHCs can bill for face-to-face medically necessary visits furnished by a dentist, podiatrist, optometrist, or chiropractor as long as the service is on the FQHC's list of qualifying visits and all other requirements are met. All services must be within the practitioner's state-defined scope of practice, and the HCPCS codes must accurately reflect the services actually being provided. A link to the Medicare Benefit Policy Manual, Chapter 13, will be placed in the chat for your reference. And our last question asked, are functional outcome assessments mandatory? Medicare requires chiropractors to perform and report functional outcome assessments for chiropractic manipulative therapy to meet quality reporting standards. These assessments use standardized tools to quantify the patient's functional limitations and document their progress toward treatment goals. And I am just going to quickly go through the chat just to see if I see any questions. Give me a moment. And I don't see any questions. However, I am going to continue. If you do have a question, feel free to put it in the chat and we can address it if we have some time at the end. For those attending today's live event, in a few minutes, you will receive an email thanking you for attending. And the email should be what you see on this left-hand side of the screen. Do not delete it without reading it. This email contains your certificate of achievement, as well as links to take the survey. And if you haven't completed it already, please take a few moments to complete this customer satisfaction survey. The contact hours for this event can be found in this email, should you require them for earning credit toward continuing education. If you don't see it, please check your junk or spam folder. Make sure to add the WebEx email messenger@webex.com to your safe sender, safe receiver list to avoid these emails going to junk or spam. And if you called into this webinar, just email us at wps.gha.education@wpsic.com with the name of this webinar and the phone number you used to log in, and we can email you your certificate of achievement. Following today's live event, if you think of any additional questions, you have 7 days from today to submit them. Send them to our education mailbox at wps.gha.education@wpsic.com and put documentation of chiropractic services into the subject line. However, if you have claim-specific questions, please do not send those to Provider Outreach and Education. Please direct those questions to our customer service department, as we do not have access to your claim information and therefore unable to look up your claims. Also remember, we cannot accept any type of PHI or PII via email. If you haven't done so already, please take a few minutes now to complete a survey. Share with CMS and us about your experience today. Tell us about your experience, including what you liked, what we could do to improve, and suggestions for future education. Your feedback is really invaluable in helping us deliver the education that you need. We use your feedback to develop topics for future education events. There are several different options you can use to take the survey, depending on your preference. For those attending today's live event, the first option is to click the survey link in the chat. The other option is to take the survey on the CMS Qualtrics page. So when you exit the webinar, you'll be asked to go to an external site. And that external site is the CMS Qualtrics page and looks sort of like we see here with that little yellow triangle. This site is not spam. It's actually directing you straight to our survey. And we'll also add a survey link to the Encore presentation. Just click on the survey picture at the end of the Encore presentation video to take our customer satisfaction survey. Based on your feedback, we've added several enhanced features to improve your educational experience. Our Encore presentation videos now include chapters, making it easier for you to find key information quickly. We've also introduced training indicators during our webinar registration to help you identify the intended audience for each session. We hope these enhancements make your learning experience even more valuable and accessible. And I do see a question, and it says, please give guidance on the best time to use an ABN. I will send that out to everyone via email, because it does look like we're at the end of our webinar, and I want to be respectful of everyone's time, but I will send that out. So on behalf of myself and Provider Outreach and Education, thank you for attending the webinar on documentation of chiropractic services. Remember, this presentation will be posted as an Encore presentation on our Training Center page on the WPS website. For more information about chiropractic claims information, Please register for our webinar, Exploring Chiropractic Claims Data, on October 1st at 9 a.m. Central Time, 10 a.m. Eastern Time. And you can register for this webinar by going to our live events webpage. Remember to take our survey with the link provided. We look forward to your survey comments and hope to have you join us at future events. You may now disconnect.